Every night we're joined by infectious disease experts in Boston for insight on the coronavirus pandemic. And tonight, Dr. Helen Boucher is with us. She is chief of the Division of Geographic Medicine and Infectious Diseases at Tufts Medical Center. Good to see you once again. So some of the states that are reporting a surge in new COVID cases are seeing those cases in younger people. So you take Arizona, for instance, most of them are between 20 and 44, otherwise healthy. That is different than what we'd previously seen. Do we know why these age groups are being impacted now?
Well, Emily, it's nice to see you. And indeed, we are seeing this sort of explosion of cases around the country in younger people. And we're still learning what that's about. But it seems that this is a group that's more social. They're out, they're going to bars, they're going to places that are high risk, and they may not be adhering as well to physical distancing and other measures like covering their faces, unfortunately.
So when we dig into the data a little bit, we talk about these positive cases. Many states showing death rates from COVID are declining, but the number of new positive cases is increasing. So why do you think that is? Are these newly infected people, young people, getting less sick than those who were infected early on?
Well, Emily, we don't know yet. So it's important to remember that death is what we call a lagging indicator. It takes 3 to 4 weeks, even longer sometimes after infection, before we see bad outcomes like death. And so right now we are seeing lower death rates, but it's early in this kind of re-wave or intense wave that we're seeing. So I think it's concerning that we're seeing so many people needing ICU care, and that bodes negatively for what we might see in the future. And I think we have to keep a very watchful eye on this, and we cannot jump to any positive conclusions yet at all.
Okay, I want to get your take on the World Health Organization now reviewing a letter from more than 200 scientists from around the world who believe that COVID-19 can be transmitted airborne, so those tiny aerosol particles that could stay in the air. What are your thoughts on this?
Well, this has gotten a lot of attention, and we have seen again and again that COVID is transmitted by respiratory droplets. But we know that there are big droplets and smaller droplets, these droplet nuclei that can be aerosolized. And so that means that certain procedures are higher risk, and that we need to keep a close eye when those procedures are done. We have not seen evidence yet that this virus is airborne, like tuberculosis and measles, for example. So, it's a little complicated with big droplets and little droplets, but the message is the same, that keeping that physical distance and doing all the measures that we're doing are the key things to protect ourselves. And we have good evidence that this works all around the world so far.
Right, and that's the key, that we know that works. Really important distinction. Dr. Boucher, thank you so much for your time. It's good to see you as always.